work is underway to open the Spectrum Health Women's Health and Wellness Center, which will make it easier for women to receive a broader range of preventative, specialty, and lifestyle services dedicated to their specific health needs. And one of many health offerings will include preventative cardiology appointments. Dr. Thomas Boyden is here to talk about what that means for patients. Good morning. Thanks so much for being with us.
Good morning. Thank you very much for having me.
It's our pleasure. First of all, what does preventative cardiology mean?
Well, if you think about cardiology in general, we're really talking about people who have developed disease, who we're seeing for potential interventions, whether it's because of coronary artery disease or arrhythmias or even heart failure. What we are dedicated to doing with preventive cardiology is getting on the forefront of that. We really want people to understand that 80% of cardiovascular disease is preventable, and it's preventable by our own actions at home on a daily basis. So we work with people trying to help them figure out what they're doing day to day, what they can do differently, what they can improve upon, so that that risk of developing cardiovascular events like a heart attack or a stroke is significantly diminished.
And I guess that kind of answers the next question of why this is so important that women get screened in the first place.
Well, I think it's particularly important for women because traditionally women are different from men, so the risk of things changes based on not really age, but when menopause starts. The protective benefit of estrogen is lost at menopause, and that's when women's risk really kind of takes off. The important thing for women to understand also is that symptoms can be different and outcomes are significantly different. We see more women dying from cardiovascular disease than men.
And so when that woman does make that appointment, what exactly can she expect when she makes the appointment? What kind of things do they need to know? And then actually following through and then going through with the screening.
Absolutely. So we like to do a comprehensive screen for any woman coming through our clinic. We like to not only examine what they're doing from a lifestyle perspective, their activity levels, their nutrition, but also any psychological aspects that may be affecting their health. We have a very comprehensive team with preventive cardiology that includes myself, a clinical nutritionist, a clinical psychologist. We also have a team of exercise physiologists and health coaches that we use to really round out the care for anyone coming through our services. So when they meet with me, they're going to first kind of fill out that background check for us. And they're going to let us know the concerns that they're specifically having. We're going to discuss with them what services might be best for them. And if they're considering hormone replacement therapy, we're going to talk about ways to really assess their individual risk, not just put them into a risk calculator and really determine whether or not hormone replacement is something that is safe for them.
So that transitions to the next thing also. What other services will be available along with the cardiology appointments?
Absolutely. So there will be preventive services for women, not just preventive cardiology services, but preventive services in general. They'll be focused on bone health, surgical, specific surgical issues for women. The most important thing to understand is when you come here to the Women's Health and Wellness Center, that this is a multidisciplinary clinic. It's going to give women the opportunity to come in for the day and see all the services that are needed for that specific individual, whether they need a mammogram or an x-ray or going through their bone screening or seeing me for preventive cardiology. They'll be able to do that kind of in a one-stop shop, if you will, and won't have to come back for repeat appointments.
Well, it looks like an absolutely beautiful facility, of course, much needed here in West Michigan. Thank you so much for your time this morning.
Thank you for having me.
Absolutely. And for more information, make sure to visit spectrumhealth.org/women's center, or just to make that appointment, call 616-267-8520.